afternoon. It's once again 5:30 on a Friday. And of course, this is your host for the next 25 minutes of the most interactive television show in the nation, Hotline 21 at Cable Access. And we are always just happy to see this time come around because I get an opportunity to interact with you, our viewers and our listeners, and mention some of the things that are going on in our life today. I've had a wonderful week. I've been in Chicago the whole week, and every day I've just been engaged with the most magnanimous people. I started my day this morning with the Midwest Association for Sickle Cell Anemia, and we just had a wonderful time. It was the biggest gathering of that group that I've been at in a long time. They had national people there. And so I've been talking health care all day, and I remember specifically what I said to them, that health is wealth, and that you can have all the money in the world, you can have all the status in the world, you can be the most desirable person in the world, you can have all the beauty in the world, but if you're sick and don't feel good, your quality of life just simply is not what it ought to be. So I always say that health is wealth. And if you are healthy, you are really fortunate. Last night I was with the dietitians and nutritionists in the city of Chicago, and they were celebrating the 100th anniversary of their being, and they gave me a apple award. You know, an apple a day will keep the doctor away, and I complimented them on their being helpful in the pursuit of the extension of life expectancy. That is, how long we expect to live and how well. Well, joining me in the studio this afternoon is Mr. Henry Taylor, who is the Executive Director, the Chief Executive Officer of the Miles Square Health Center, which is right down the street. And not only is he that, but he's also the Speaker of the House for the National Association of Community Health Centers, which is their national trade association that works hard to make sure that they continue to exist. Henry, I am delighted to have you with us.
Thank you, Congressman.
And what's going on with Miles Square now?
Well, thank you, Congressman, for inviting me and allowing me to have a few minutes with your audience and with you today. We are fortunate because Miles Square Health Center is celebrating its 50th anniversary in the Community Health Center movement.
50 years?
50 years. Can you imagine?
That's a long time.
That's a long time. What's important that Miles Square and the Community Health Center movement was framed out of the war on poverty, out of the Johnson administration. I don't have to tell you, you know more about
indeed.
that than I do. But when you look at Medicare, Medicaid being key hallmark entities for the United States government, and then having the Community Health Center movement, Miles Square is selling 50 years in that movement. We are titling our celebration on November 3rd from 5:30 till 7:30 in the evening, celebrating the past and embracing the future, because we want to recognize all of the things, all the community residents, all the community activists who helped make Miles Square what it is today. And one of those activists is sitting right next to me, you.
Well, let me tell you, I have been very fortunate in life, and I've been fortunate enough to work in the health center movement to have experienced it. I didn't, Near North celebrated its 50th years last week.
Correct.
And Miles Square this week. Of course, the National Association last year. And of course, Mount Bayou, which was the very first one,
indeed,
along with Tufts Medical Center in Boston. What is so unique about the federally qualified health centers? What makes them tick?
Community health center, federally qualified health centers are very different in the way care is practiced. First and most importantly, it's run by a community board, a community board of directors, individuals from the community who can speak to the policies and procedures and the way care should be delivered within the community. So that for me is the cornerstone. When I think about the challenges that exist today in our country, I think the model for solving those kinds of problems exists with incorporating business and community together, not one separate from the other. So the community health center model, the community health center model is very unique to community health centers, meaning the board of directors for community health centers.
Are we talking about, something about the size of a block club, where the community folks get together and decide things?
It could be, in fact, yes.
Yeah.
For example, you know the history of Miles Square because you helped write it, and being part of it, you had individuals like Early Lindsay, who were activists on the west side of Chicago.
Absolutely.
Mamie Bones.
Yes, indeed.
And our own Edna Pierce, who will be celebrated on November 3rd for the work they've done.
How old is Miss Pierce?
I'm hesitant to say because a woman never tells her age, but she's a young, active woman.
I think she's in her 90s.
I think so too.
Yeah, I think.
But she'll outrun both you and I.
Yeah, she's in her 90s.
Indeed.
Are these small things, or have they become real enterprises? How big? How many people does Miles Square actually see?
Very good question. These are enterprises, and they vary from state to state. Miles Square specifically cares for over 40,000 individuals throughout the Chicagoland area. That's a large number of patients. Those patients create over 100,000 visits at our practice. Now, we have 12 practice sites, 5 regional sites throughout the Chicagoland area, including Cicero, and some of the most economically challenged communities. So that's when you ask what's unique about community health centers. We want to be where the greatest need is. Anybody can provide care in those environments where people are well-to-do, where there's money and there's resources. But we challenge ourselves to provide care where it's needed the most so we can make the biggest impact on our society. We have a practice in Inglewood, we have a practice in South Shore, we have a practice in the back of the yards, we have 5 school-based practices, and we have two practices focused specifically on behavioral health because of the challenges that are evident in that community. We just recently received a grant to also, as you well know, Congressman, to help address the opioid crisis in the United States.
Okay.
So we're now providing substance abuse care specifically for patients who struggle with drug abuse as well.
So how does one become a patient, a client, or avail themselves to these services?
Okay. For us, we have a very easy process. Our call number to make an appointment is 312-996-2000. You can make an appointment. What's unique also about Miles Square is we have urgent care. Urgent care is we're open 365 days a week for patients who have urgent needs to avoid using that emergency room. Very unique. Now, what most people don't realize is that when you hear about Walgreens walk-in practices, you hear about CVS, but few of these organizations, if any of them, really reach out to the underserved. You can't come in there if you don't have any insurance. Well, Miles Square and community health centers across the United States care for patients regardless of their ability to pay. And what do I mean by that? If you don't have insurance, we want you to come in for care. Not having insurance is not a reason for you to get care, and that's important for us to emphasize. If you don't have insurance and you're self-pay, we put you on a sliding fee scale. And that our basic sliding fee scale slides down to $20. So $20 for medical care. And if you can't afford that $20, we waive that $20 because it is important for us to change the behavior and change the health in the community. And we can't do that if people can't get access to care. Now also, when you think about the care we provide, We provide primary care, we provide OB/GYN care, we provide HIV care, we provide PEDS care. We have an optometrist, we have a dental service in our South Shore practice, so we can provide care across the lifespan.
So I, Danny Davis, can just walk up to Miles Square and say, I want to get my health care at the Miles Square Health Center.
Absolutely.
Or as a part of this network.
Absolutely.
And someone will do what is called, I guess, intake.
Intake registration.
Find out all about me and stuff.
Indeed.
And what I can pay, what I can't pay,
Indeed.
what I...
Indeed.
And from then on, that becomes my medical home.
Indeed, and that's the intention. Once you're part of our practice, we want you to stay with our practice. We want our patients to choose a primary care provider so they can get continuity of care. But we also provide walk-in service because we know sometimes life is unpredictable. So we want our families to be able to say, well, you know, we need something right now. That's why we created urgent care, and that's why we offer walk-in services at all of our practice sites. So yes, if you come in, we'll see you, we'll evaluate what your needs are, and we will provide care to you. That's our core mission. Miles Square is even further unique because of this relationship with the University of Illinois. We are an academic community health center. We have teaching residents, research that's occurring in our practice. We provide a link to the best science in the United States by having a relationship with UIC. So when our patients need specialty care, we provide that link to the University of Illinois, or we provide some of that specialty care within the walls of our Miles Square practice.
All right, well, let me see if our callers can't get in here. I know somebody was trying to get in a moment ago. So callers, if you want to join us in this conversation, give us a call at 312, I don't have my glasses on,
738-1060.
1060, and you can talk to Mr. Henry Taylor. And Henry, while we're waiting for a caller, explain what you're doing on next week coming up.
On the 3rd.
On the 3rd coming up.
Indeed. Our Gala Celebration, celebrating 50 years in the movement, starts at 5:30 and we end at 7:30. We have established the Congressman Davis Pathfinder Award that will be presented by Congressman Davis to Senator Durbin. Part of our vision is to ensure that we recognize those individuals that have helped us and have been stewards of the community health center movement for generations. I don't know if the community really recognizes the kind of work you've done to ensure that people who have been underserved, who have been locked out of systems, have access to these systems. One of which, most importantly, is healthcare. So it was important from us, from a Miles Square perspective, to create an award in your honor and present that award to a legislator, and we will do this on an ongoing basis. The other important feature of this gala is the Chancellor for the University of Illinois will present the Chancellor's Award to Congressman Davis for his just outstanding work and everything that he does. So we are very excited for that to occur. We have other notable individuals who will receive award. Sandy Goldberg, who is chairman and founder of the Silver Lining Foundation. Now, Sandy's very unique. For generations, she's provided free mammographies to women who have suffered for breast cancer screening at Miles Square. So we would call and say we have a woman who's uninsured who needs breast cancer screening, and she and her foundation would fund that. We're providing an award to our own Associate Vice Chancellor of Community-Based Practice, Dr. Robert Wynn, for the outstanding research he's done in communities overall, specifically his focus on cancer, so we're very proud of him. We've had some tremendous support from the Illinois Children's Healthcare Foundation, and President Heather Alderman will receive an award for her work and her continued support of Miles Square Health Center. And our own Edna Pierce, who is one of the founders of Community Health of Miles Square, will receive an award for the work she's done. Now, as you said, Edna is, I won't say the age, and been around for a while, but she still stands strong on the board of Miles Square, wouldn't do it any other way. So we were very pleased to be able to recognize one of our own.
Well, I think all of Chicago really should be looking forward to this Gala celebration. And while I am appreciative of any acknowledgement of work that I may have done, and we sing a song at my church sometimes, let the work that I've done speak for me. But the real deal is that when Miles Square started, the near west side of Chicago, where it was primarily located, had one of the highest infant mortality rates in Western civilization. And infant mortality is a measure of quality of life. Generally means that if the infant mortality is high, the quality of life is low. If infant mortality is low, then the quality of life is high. And we can truthfully and honestly say, based upon measurement, that in that community where Miles Square started, the infant mortality rate has improved, has declined, has gone down, which is an indication that people have a better health status than they did 50 years ago when Miles Square got started. And another thing many people may not know, especially African Americans, we often talk a great deal about disparities and we're not up to snuff. Well, life expectancy, the gap between whites and blacks, and the life expectancy has always been like this, in terms of one group expected to live much longer than the other group. That has closed significantly. And so with that kind of information, it really means that these outfits have been doing great work, that they've been doing what they were established to do. And that's why we want to make sure that people use them, that people know about them, that people understand their role. Not only that, they bring a lot of money to communities. Could you mention how much money gets generated as a result of these centers being in a local environment?
And the community health centers throughout the United States are considered economic engines for the communities they serve, and in fact create billions of dollars in revenue across the United States. Miles Square's budget alone is $25 million for just our practice sites. And imagine buying goods and service throughout the city of Chicago. That creates jobs. We hire from the community as for our practices as well. So we have a major impact on the economy of the city of Chicago, and so do community health centers across the United States. So we're very pleased about that.
Well, I am so pleased and proud to just simply know that I have been involved in some way with the establishment of these centers, not only locally, but also nationally, and the work has been so rewarding. Now, I understand that there is one person running for president who has suggested that if elected, or when elected, I'd like to say, but if I don't do partisan politics on this particular show, but one candidate has said, if you folks elect me, I'm going to put about $80 billion into the community health center pipeline over a period of 10 years. What that would mean when it happens is that people all over America in these little rural places where they can't get to a doctor are going to have medical care. Let me see, was that a caller? No. That these people are going to be able to get top flight medical care that should aid them. Young people from those communities get a chance to go to school and get interested in medicine and health and become physicians.
Indeed.
I am amazed at the number of young people that I know straight from the hood, from the west side of
That's
Chicago,
right.
from the near west side, and from the south side, who have gone to medical school and who are now practicing medicine.
Absolutely.
And who come straight out of North Lawndale, come straight out of East and West Garfield, come straight out of Inglewood, straight out of Austin. Not as many as we'd like to see, but I can sure tell you many of them have come. I get letters from them every once in a while saying that the little scholarship that you gave me helped me a great deal, and I'm now back practicing. Oh, it's just good stuff.
Indeed. But also,
Joyce.
part of the benefit of being in the community health center is the National Health Service Corps loan repayment program. That's very important to the model that allows community health centers like Miles Square to recruit physicians who have come from the communities we serve and give them a relief on the debt that they carry getting through medical school. And that's an important part of this new the legislation that you've passed, Congressman, and important part of what the current president candidate is looking to do.
So if you want to be a doctor and your family does not have money and you think you ain't got enough money to go to medical school or get into the university or college, if you're willing to commit to come back and work in what is called medically underserved communities, the National Health Service Corps will pay your tuition. And you don't have to do anything but go to school and study and, and study 8 hours a day or whatever it takes, and you too can become a physician. You can be an anesthesiologist. You can be a radiologist. You can be whatever your manhood, womanhood, talent, ambition, hard work, and ability would propel you to be, and that's what we're trying to project. I tell you, it's a wonderful way to live, make a living. We got about another minute, Henry, so you want to redo and wrap up?
Surely, but I think what I'm most struck by, being privileged to do this for over 20 years, or close to 20 years, I should say, is that the spark of an idea, the activity in the community can make a difference. And I don't want us to forget that. I don't want that to be lost, because the community health center movement is drawn and grew out of the community, and we need more of that. And I think right now in our society we need to engage the community in solving problems that exist in our community, and this is a model that works for us. And I definitely want to thank you for the work you've done in the community. I want to thank you for the work you've done on behalf of Miles Square, and I've had big shoes to fill as I've come behind you in working at Miles Square.
Well, thank you very much, and I really appreciate that. But you know, Earlene and Mrs. Pierce and Mamie Bone, people out of the public housing
Indeed.
projects became members of the board and helped create these instruments, and they were set up around public housing developments all over the country, and now they undergird primary care in these United States of America. Thank you so much, Mr. Henry Taylor. Thank you to our listeners and viewers. We'll see you next week.